afternoon, Dr. Madrid. This is Nurse Eunice from the surgical ward. I'm calling about Miss Ramirez in room 1010.
Hello, what's the issue?
So, the problem I'm calling about is hypotension following her appendectomy. So, Miss Ramirez was admitted yesterday for acute appendicitis and underwent an appendectomy this morning. She has no known allergies or chronic illnesses. Postoperatively, she was stable, but in the last hour, her blood pressure dropped. So, her current vital signs are BP 85/50, HR 120 BPM, RR 22 breaths per minute, and temperature of 36.8 degrees. And her skin is cool and pale, and she appears weak. Her urine output in the last 4 hours is only 20 ml. So, I'm concerned about possible hypovolemia. So, should we increase her IV fluids, consider a bolus, or check for internal bleeding? Or would you like to order labs such as CBC and serum lactate?
Start an IV bolus of 500 ml and it's over 30 minutes. Order stat, CBC, and serum lactate. Monitor urine output and call me if BP remains below 90/60 after the bolus.
So, understood, Doc. I will implement the orders and update you on her response.
Okay, thank you.
Thank you, Doc.
Good evening, Dr. Muñoz. This is Nurse K from the delivery room. I'm calling about Mrs. De La Cruz from room 112.
Hello, what's the problem?
The problem I'm calling is about excessive postpartum bleeding. Miss De La Cruz is a 28 years old G2P2 who had a spontaneous vaginal delivery for 2 hours ago. She had a normal pregnancy and no significant complications during the labor. However, she is now experiencing heavy vaginal bleeding. Her uterus is soft despite fundal massage.
Vital signs, please.
Her current vital signs are 90/60 for the BP and HR is 130 while RR is 24 and temperature is 37.1. She has soaked 2 perineal pads in the past 30 minutes. The fundus is baggy and there are no signs of retained placental fragments based on the initial assessment. So I'm concerned, Doc, about the postpartum hemorrhage. Should we initiate oxytocin IV or consider additional uterotonics such as misoprostol? Should we also prepare for possible transfusion?
Okay, start oxytocin IV infusion at 20 units per liter of LR. Administer 800 mcg misoprostol rectally and continue vigorous fundal massage. Order a stat CBC, prothrombin time, test with an INR, and type and cross-match in case a transfusion is needed. Keep me updated on her response worsen.
Understood, doctor. I'll implement the orders and call you back if the bleeding continues or her vitals.
Thank you.
Thank you, doctor.